Hi there, I'm Dr. Loh, one of the obstetricians and gynecologists and fertility specialists here at Sunway Specialist Centre, Damansara. Well, I think it's a common myth. You can actually use this as a form of contraception, but you need to fulfill two criteria. One criteria is that you have to be amenorrheic, meaning you cannot have periods. So if you're having periods in between, it suggests to me that you could potentially be releasing an egg. Secondly, you need to be exclusively breastfeed. It doesn't matter if you pump it out or whether you direct latch. It has to actually happen within the first 6 months after you deliver as well. So after 6 months, baby starts to wean and the breastfeeding hormone will not be as high, which means that you could spontaneously release an egg and get pregnant. It is a great way of weight loss after the delivery. You burn an extra 500 calories a day. However, breastfeeding also makes you very hungry. If you watch what you eat, then obviously weight loss is possible. What I do advise is to have a controlled diet after you've delivered to try and reduce the weight gain. Of course you can. Whilst you're breastfeeding, it's a great time to have sex, particularly if you're exclusively breastfeeding. You are protected against pregnancy. Unfortunately, breastfeeding also releases this breastfeeding hormone called prolactin. And prolactin seems to have an effect on the woman, maybe as a natural form of birth control. A lot of women actually, they have no desire to have sex at all. I would advise that you make sure that you conduct lots of foreplay and make sure that you maybe use a little bit of lubricant if you're dry down below. So breastfeeding is a very beautiful journey, but it is a tough journey. And I think that one of the most important things is managing your expectations. We can do certain things such as skin-to-skin contact after baby's born. We can introduce the breastfeeding early on, within the first hour of life. All these will help contribute to the breastfeeding journey. Sometimes the milk takes a while to come in, so you might need to keep putting baby to the breast regularly because remember, it's a supply and demand thing. And lastly, it's actually to try and relax and enjoy the journey. Breastfeeding itself does not cause your breast to sag. Unfortunately, pregnancy does. Pregnancy will cause your breast to grow bigger. And if you do have milk engorgement as well, then yes, the skin around your breast will stretch and there is a risk of sagging. How your skin reacts to stretching also depends on the amount of collagen you have. So unfortunately, genetics and pregnancy are the culprits, not breastfeeding. Thank you everyone for listening to me share some truths about breastfeeding. I just want to wish all breastfeeding mums the best of luck in your breastfeeding journey, as it is not an easy one, but it is definitely a fulfilling one.